How are you doing, Chip?
Good.
You are the owner of Tampa Bay Imaging.
One of, yes.
One of the owners.
Yep.
Okay. How long have you been doing that?
So we have two facilities. First facility opened in 2001, and then the one in Tampa that I run opened in 2004. So 20 years.
20 years. Wow. So I know that you guys are sort of on the cutting edge of technology.
We try to stay there. Yep.
I get a lot of clients who ask about the difference between, well, they don't exactly ask about the difference of an X-ray and an MRI. They just come in and say, well, I'm in pain, and they said nothing's wrong with me. I went to the hospital and I had an X-ray and a CT scan, and they said I'm fine. And then I say, well, it doesn't necessarily mean you're fine, because there are differences between these tests and you may need further testing.
Yep.
And we even, with our intake team, actually, we will put an X-ray up versus an MRI so that they understand the difference. Tell me a little bit, if you can,
Sure.
about the difference between an X-ray, a CT scan, and an MRI. And I'm going to ask you to do it. And like when I talk to ChatGPT, I say for a 7th grader so that I understand and everybody understands what the difference is.
Well, that's easy for me because that's about my top level anyway, so that's perfect. So the first thing you said is a very common problem I hear, and this is a hospital problem, right? Somebody's in an accident, they take them to the hospital. The hospital is going to do X-rays because they're looking for broken bones. They're going to do CAT scans because what they're looking for is internal injuries and brain bleeds. And you'll see these outlandish bills that come from all these studies that they really didn't even need to get done, but that's a CYA event going on at the hospital.
Yeah.
Okay.
You're trying to make sure nobody's going to die,
If
right?
they discharge somebody who has a brain bleed, there's going to be a real problem on their hands.
Absolutely.
So X-rays, I kind of just mentioned, you're looking for bony things. You're looking for fractures, bone spurs, things like that, okay? That is normally in a treatment program, step one. If you have a client who's in a clinic, I'm in a doctor's office, most of them have their own X-ray. They're doing that because having a fracture is a real issue.
Right.
Okay. The next step from there is either a CAT scan or an MRI. Typically, we only do MRIs and X-rays, but we see the people post-accidents that come in because now you're looking for, is there a soft tissue injury, which X-rays will not show. Okay.
X-ray's not going to show a soft tissue injury, right?
Correct. X-rays will not.
CT scan's not going to show a soft tissue injury.
A CT is a very fast multi-slice X-ray. So it's taking a series of pictures and putting them together. Computer-wise, that's what C stands for. And it's taking all those and rendering a picture for you, but it's not getting soft tissue either. So the only way it is, if someone tells you, oh, I've got a bad disc, they did an X-ray and they saw it, they got bad information.
Right.
That's not true. That's not true.
But they're cheaper than an
They
MRI.
are cheaper. Correct.
Which
correct. And
might have something to do with the hospital deciding, that they're not going to routinely do an MRI.
correct. And MRIs take longer. So, and they're
So they can't
typically,
move 'em in
and
now.
so when hospitals not only have people coming into the emergency room, they've got their inpatient people that they need to bring down. So they've got a
fair.
regular schedule going, and the CT they can get out much quicker. So that's for sure. Yes.
And an MRI, as opposed to just showing the bones, is going to show...
It's going to show me the actual disc that are between all your vertebrae. It's going to show you ligaments, shoulders, knees, anything inside there. So when you talk MRI, what you're looking for is, does this person have any sort of an ACL problem? Do they have a rotator cuff issue, a supralabrum tear? Do they have something going on in their brain? MRI is very good for brains. Do I have a blown disc, herniation, extrusion, any of those sort of things? Absolutely.
So I'm an old enough biatch that I remember when I first started practicing that doctors did not sometimes order MRIs because they didn't know how to read them. And they were always ordering myelograms. Do you remember myelograms?
Vaguely, yes. Yep.
Shoot your spinal column up with a bunch of dye and then take a picture.
Yep.
That you can get a drop foot. There's some horrible things that can happen from that. X-rays have radiation, right?
Correct.
I know a couple times they X-rayed my daughter's pelvis, thinking that she had a broken coccyx, and I was like, I don't even want you to do that,
Right.
because, and the retort was, well, it's less than a plane flight, but who wants
That is the old saying, yeah.
Okay, it's my kid. Why do I want repeated
Right.
exposure to radiation?
Now, listen, there's a reason why at the dentist they put a big, lead thing on your chest when they're doing facial X-rays. You don't want it. You don't want too many.
And the CT scan's got to be even more radiation.
So a CT is going to be more than an X-ray, absolutely. And there's definitely amounts that become unsafe if you're doing too many. I couldn't tell you that number, but
Right.
it's there. It's a real thing.
And to what we know medically, is there any sort of ramification like that about MRI?
No, there's no radiation involved. It's all done with magnets. So quite the contrary. Some people feel that magnets could have healing properties and bring blood into
Yeah,
areas.
people
So
wear magnets. They wear, they buy them and wear them for
we've
their...
definitely had people come off the table, say they come in for a knee MRI and they get off. They're like, man, my knee feels pretty good right now. Now, is that psychosomatic or is that a real thing that blood flow got pulled in there?
Or is it temporary?
Correct. All of that stuff. Now, there are some contraindications for doing an MRI, as in if you have aneurysm clips, things that are metal in your body. So we've got a very extensive form that's filled out about things that you've had in your past, any surgeries and things. So we know anything that's ferrous, metallic in your body, we can't do an MRI. It'll shift. It happens a lot. People that have worked with steel in their past, steel workers, we have to do X-rays of their face before we put them in because they'll get little pieces of metal lodged in their eyes, and they don't even know they're there. But we have to check it to see on X-ray if we see the metal. If we do, we can't do the MRI. We've had BBs lodged into people's face.
Oh, that's crazy.
Can't do it. Yeah.
I didn't even think about that. But generally, when somebody's prescribed an MRI and they come in, I'm sure they're fearful. Well, I'm fearful anytime they prescribe me a test.
Sure.
But I really think, I see so many people after an accident, they have unexplained pain. The general PCPs don't order MRIs. It takes like an act of Congress. I don't know why. And maybe you know why. I don't know why they won't order it.
So it's all about training, and it's also training as to what is insurance going to pay for. Okay. So you're in your PCP's office and you say, my knee hurts. Okay. An X-ray is really not going to show you anything. But you can't get a knee MRI authorized via Blue Cross Blue Shield, to name an insurance, without doing an X-ray first. And then they'll say, okay, the X-ray was okay, so let's do physical therapy for 6 weeks. Which, by the way, costs way more money than one single MRI does. It's just that's what the protocol is set up. Whoever's making the protocol, it's not you or I, but whoever is, that's how it's set up.
I've never understood that, and so one of the things that we do, we try to really educate people when they come in about their health. I'm not a doctor, but I've seen people in these scenarios for so many years. I've had my own accident, I've had my own, set of, challenges like that. And so my husband used to be a pharmaceutical rep.
Okay.
And studies show that doctors give you what you ask for, which is why there's all those commercials like, ask your doctor, And so I tell my clients, go ask your doctor for an MRI. And I don't know, maybe, there's capitation with PCP doctors. They're not supposed to spend
Correct.
more than a certain amount of money. And maybe, I'll send you for an MRI and that's expensive. And maybe you'll find the problem. And then you'll go to an orthopedic surgeon, you'll have surgery, and that's going to add more money. And then you're not going to fit in that $100,000 a year. I don't know what the thinking is, but it makes me angry a little bit because having an MRI is not a drug. It's not invasive. You're going to sit there with headphones on and, for 45 minutes or I don't know how long.
Depends on the body part. If we're doing a lumbar spine, it's as short as 18 minutes. We've got studies, the shoulder studies are going to be 35 minutes. We've got some studies that are abdomen and pelvis type that can run an hour and a half. So it really depends on the body part.
But if you're doing an hour and a half, you get breaks.
Yeah, we will typically pull people out, give them a little time. So what we've found is you talk about fears that people have, MRIs or whatever. It's claustrophobia they worry about. Can I stay still that long? Things like this. What we find is more people think they're claustrophobic than they actually are. The idea of it is worse than the actual event. Okay. So you give them the confidence. We let people come in with them. You can come in and sit and hold your person's hand while they're in there, kind of give them peace of mind. And then once they're in and going, we don't like to stop because then you start the clock over again, right? So you were fearful to get in the first time we got you in. Let's just keep going as far as we can until you really say, I got to get out. So, all the machines are made and ours no different. You have a little panic button that if you hit that, the speaker comes on. What's going on? I really need to get out. Okay, no problem. Pull the table out, talk to you.
I think too, when I went in for the neck MRI, I thought, because I kind of dragged my feet on that. And I say I drag my feet on that because kind of going to what I was saying before, I tell my clients, go back and ask your doctor and say, I would like you, maybe do more than ask. I mean, not be obnoxious, but be a little bit proactive about your own health and say, I would like you to prescribe me an MRI. And then they generally will if you're requesting it.
Correct.
But when I went in, like I had this idea that the tube was going to be like this far from my face and I was going to be very closed in. And I really didn't find that at all. Like the top of my head was open. I mean, even for a brain MRI.
Yeah.
How close is it to your face?
So, our machine we're 20 years in business now, so it's a 20-year-old machine, but even the technology in the sense of the way they build them has gotten so much better by then. So ours is what's called a wide short bore machine, so it's not as long. So like you said, on both ends, it's open. So the light's coming in, makes you feel more comfortable. And it is, you've got about a good foot minimum space between your nose and the top of it. Okay. So it's perfectly round, with the table inside. So is it comfortable? It's not comfortable. I'm not going to lie to you. Nobody wants to do it, right? No one wants to sit there for 20 minutes and not really be able to move very much and control their breathing and all that. But you need to if you need to know what's wrong. It's that simple. But it's more people are afraid of it without even knowing what it is, quite frankly, is what we find.
Well, and you're being not considerate when you say it's not comfortable, because I guess you're thinking you're laying sort of on a straight hard surface. But I got to tell you, when I went, they put the pillow under me. They gave me the thing for my
Listen, it doesn't bother me. Whenever we're working with new software, I'm the guinea pig. I jump in there because it's freezing. It's 1,000,000 degrees outside, so I'm nice and cool. I got a blanket on. I got music on.
Put a blanket on you.
Yeah, I'm good with it.
I mean, I tell you, the most painful part of getting an MRI to me is actually taking the time to do the same thing problem that I have with everything from, going to my gynecologist to getting my nails done. It takes time, and I don't feel like doing it. And, and people, like, there's the fear. They're thinking, on TV, you see, like, the person's getting a test. These are in this long alien tube, but that's not what it looks like.
Right. It's not flattering on TV. Yes.
Yeah. It's shorter, like you said. Parts of your body are out. Yep. You're not. It's
like
not
we
like
put if we're doing your lumbar spine, your lower back, we actually put you in feet first, so your head never goes in. A lot of people don't do that, but and there's certain things you have to make sure the radiologist knows about, obviously, in doing such, and it makes it a little harder their job. But we find that it makes people so much more comfortable if your head never actually goes in.
What if you're if you think you're claustrophobic, or you get there and you really are claustrophobic? You're not just thinking that.
Right.
Or you're a super big person. Do they have open MRIs?
So there are open MRIs. You talked about how far away the tube was from your face.
You said a foot normally.
I'm estimating it's about a foot, normal sized person. Open MRIs, the walls are missing, but it's actually lower, closer to your face. It's more of a flat thing. So me personally, I think I'd have a hard time with that. And then you factor in the real clinical factor, which is MRIs work on what's called a Tesla level. That's how strong the magnets are.
Tesla?
Okay? Tesla, TSA, like the car. And open MRIs are everything kind of 0.7 Tesla and below. And then the high field MRIs are 1 and above. And you can't get certain quality pictures with an open MRI that you can get with high field MRIs, we call them. Okay. We don't like to say closed because that scares people. So we call it high field.
Nor regular.
Right. So they're faster. Okay. High field are faster. You can acquire more data quicker. And it's the difference between everybody has high definition TVs now, right? Like we're old enough to know, not even color TVs, but if you see a picture that's not in high def now,
oh yeah,
you can't even look at it.
Oh my gosh, I'm looking at it. like I said, my husband, he likes these 80s movies, obsessed with them, and
Yep.
I'm like, they're blurry.
Right.
You know, now if there's a football game, I can see the pores on the guy's face.
Exactly.
You know?
And that's the difference between an open MRI and a high field MRI.
Now, and back in the day, the doctors used to say, well, an open MRI is like a Polaroid, and a closed MRI is like is like a 35 millimeter. Obviously, that's dating me, but it's so crisp.
Absolutely,
like,
it is,
Shut
right?
up, shut up. But the high def, I mean that. And to me, if I'm going to take the time, well, first of all, I'm in pain. I want the doctor to have the best information available on it. The doctor can't see what's wrong because the picture's a little fuzzy. Like, why would I do that? Well,
You're wasting time and money.
yeah. And you guys have some unusual equipment in the sense that I think you guys, so part of the accuracy depends on the picture is taken at such
Right.
close intervals that you call it slices.
Correct.
Correct. Nobody's slicing you. But it's like layers.
Right. So when you take a picture, you can make that picture as wide or thin as you want in millimeters. So we do two things. We take very small slices, so the definitions is the best it can be. Okay, so we're
So
magnifying.
without throwing any shade on the competition, you feel like ours is maybe more accurate because it's taking the slices are smaller?
Right. This has nothing to do with anybody else. What we
Right.
do, we make sure that we don't sacrifice quality for time. Okay. So I could do MRIs faster than I do. But if I do that, I'm going to take less pictures. Less pictures equals less data for the radiologist and the referring physician to have. Less data is less information.
So just so that people understand, when you say less pictures, okay, in microcosm obviously, but if this is the space where the disc is,
Yep.
then you could have X amount, maybe I'm going to say 5 versus 20.
Well, let's break it down easy. Let's say a disc is 10 millimeters high, the disc in between your vertebrae, right? So we're going to take a 3 millimeter picture, and then we're going to take another 3 millimeter picture, and we're going to do that right after the other one. So we're going to keep doing that until we get even into the bones, the vertebrae above and below. So in 10 millimeters, we might take a total of 4 to 5 pictures.
And which one is axial and which one is sagittal? I can't remember.
So the axial is the ones when you see the looking down at the disc, when you see those, it looks like it has wings and everything. That's going to be your axial.
So it's going from the top to the bottom as opposed to one side to the next.
Correct.
Horizontal.
Correct.
If you
Yep.
will.
Correct. So we're going to do that. Some people choose to take a bigger slice, let's say a 4 millimeter, 5 millimeter slice, and they'll take that and then they'll skip a couple millimeters and take another picture and another picture.
So you might miss what's wrong.
So when you have a 1 millimeter herniation in an area that you never took a picture, you're never going to have that information.
What about, and now I know that sometimes a knee or a shoulder in the olden days would come up completely normal, and then they'd go in with an arthroscopy, and that would be it's almost like a diagnosis exploration surgery.
Yep. Super
Has
painful.
that changed?
Super painful.
Yes. Has that changed? I mean, have we gotten better with those tiny little joints?
Yes, we have. So as technology and software have gotten better that runs the machines could always do it. We didn't have the software computer protocol know-how to make the machine do it. And that's where things have gotten better. So we were doing arthrograms up until about 10 years ago.
Oh, yeah.
And then our head of radiology kind of said, listen.
Also shooting them with dye. And
right. So, we had a doctor that come to the facility, shoot the dye, put them in.
I mean, sometimes people don't even know that they're allergic to dye until you jack them up with it.
Can be, right. Certainly can be. So, and again, super painful. So we stopped doing it because in his research and studies, he found that it wasn't giving him better data. Like the protocols he was running now that are constantly evolving, he's getting that data. So he's pretty much, there are some things in the wrists and elbows still that kind of call for that to be done, but most of those are only being done in hospital settings at this point. And you do the study twice. Like you do the wrist without it, then you shoot it up and do the whole study again. And it's long and painful and expensive. It's tough.
Yeah, it does not sound like an attractive
Well,
afternoon.
and one rule in medicine is don't make a non-invasive study like an MRI into an invasive study.
Absolutely.
If you can avoid it, because there's always complications.
Oh,
Potential.
yeah, no, like I said, even well, with the milligrams, it would have, people would have a drop foot. I mean, it would be,
Yep.
you know. So I try, everybody in my office goes through, we're not medical people, obviously, but we get into the position where we're talking to people who've had injuries, and we try to make sure that everybody's educated about this so they can advise them the same they would their, sister-in-law or cousin or whatever. If you're having any sort of problem, there's no reason not to get an MRI. There's no downtime. It's not invasive. You're, for the most part, going to, relax with a few blankets,
Right.
listen to some music.
Right.
And it's going to give your doctor information that's accurate.
Right. It's like you said, sometimes you have to kind of lead your treatment. You got to push doctors in certain directions. But it's important to listen to them too, because some people want to come in, they want 4 and 5 MRIs, and they don't need them. You're just bringing in, potentially other problems that there's, findings that happen that have nothing to do with an accident. And it's nothing, but now you start going through procedures to look at that. And the next thing you know, you're spending all your time and money on it.
It can get crazy.
Yeah.
Right. Well, and like anything else, common sense has to rule the day. So if you're,
Yep.
if you had this little twinge for 5 years, when you're there for a major problem, maybe that's not, and maybe that's not the time, but you got to follow your intuition.
Absolutely.
And
Yep.
certainly, and I've actually had doctors call me and say, they're accusing this guy of making his pain up and saying that, he doesn't have a problem. This is a $500 impact. And then, the doctor calls me and says, hey, we got the results of the MRI back. This guy's got cancer. It's metastasized to his spine. I mean, nobody knew. He
Right.
didn't have any. So if you feel like something's wrong, you have to follow your intuition and get it checked out.
Yep.
And not really a downside other than the fact that when you say that people get worried about sitting perfectly still or laying perfectly still, if they move, there's nothing terrible that happens.
Now you just get a little bit of motion artifact. And if, as the technologist is doing the study, if they see that the images were affected too much by that, they'll just redo that little section again. You don't have to do the whole study again because you do it in parts. So, but you have to move pretty good for that to happen.
So the MRI police are not going to come on. It's not going to be screaming at you or anything. It's
You
like
get
a
3
horrible
chances,
day.
right? 3 chances.
They're encouraged. They will need you to just relax and just.
Listen, you're doing great. Just try to remember to stay still. I'm going on the next sequence. And they may be doing the same sequence again without even telling you, just so you're not,
Feeling like you made a bad grade in the
correct.
principal's office
Exactly.
or something.
Right.
How do you decide to open up an MRI facility? How did that happen for you?
So for us, one of my close friends from growing up is a radiologist. So as he was finishing school, we were in college together. He's a bit older. And he was working in South Florida, in Miami, at a hospital, and got involved in an outpatient center, like we have here. But he had one down there. He's still at the hospital. And for me, I was teaching school, and by the time my second kid, and one day I said to him, wouldn't be a bad thing to start making some more money. And I loved what I did. But and he's like, the place I'm working with, we're not getting any business. We don't have anybody marketing. Let's do this together. So I kind of joined on that. And then a couple years later, we decided, let's open one up here. And that's how these got opened.
And that was 20 years ago.
So that would have been, yeah.
And you're still in business with one
Same
of your
people.
best friends.
Yep, same people. Yep.
That's rare because
It can be,
it
right.
can be dicey, right? In any business with either family or close friends.
So you will hear people say, never go into business with family or friends because it's going to ruin the relationship potentially. It's not bad advice. But the better advice to me is only go into business with people, A, you can trust, and B, you know that if the business fails, it's not because you didn't work your best at it. It's going to be that it just wasn't the right business to be in for you. So that checked the boxes for me. The 2 main people I'm in business with, fully trusted them, and we all fully trust each other that we're going to do everything we can every day to make the business the best it can be. And you hold each other accountable.
Right.
You have to.
So it's not only trust with money, it's trust that everybody is going to be
Correct.
moving toward the target at the same pace. Maybe not all the time because we're not robots, but you know that you're going to work hard and you trust that he's going to work hard.
Everybody gets off the rails, but as long as you have people to kind of put you back on and keep you in line. Absolutely. Well, listen, you've seen law firms that
So it's a business divorce.
Right. One person is bringing more to the table than the other, but they're splitting things equally. At some point, this
It's over.
This is not going to work. Yeah.
That gets old.
Yep. Yep. Absolutely.
Yeah, I've seen that, and I've seen people in business with just the disputes about money. They turn I don't know, into different animals. But when you guys opened this business, you were children. You both already had careers.
Correct.
Because let's say you go, into business with somebody right out of college or something like that. You really don't. You know them as a person. You knew them in days that you were carefree, but you didn't see them tested by life.
Right.
So by the time you guys went into this, I think you were a teacher, you had your master's, and you were coaching basketball, right?
Yep.
So, your buddy was a radiologist. You've already demonstrated your work ethic.
Sure.
There's
a body of work there. There's
right.
Yeah.
You don't, the reason to trust him is just not, like Goodwill Hunting, you grew up in the same hood.
Right.
The reason to trust him is, in addition to that, he's got a demonstrated work history.
Correct.
Because you can have a very highfalutin position and be lazy as hell.
Absolutely.
I mean, they're brilliant people who are not hardworking.
There's not grinders. Yeah.
They're not grinders.
Yep.
Yeah. And I think no matter what your business is, no matter how great the product that you have, if people don't know about it, it doesn't help anybody.
Right. Right.
So, what's the thing that you're the most proud of?
Most proud of
In all this?
Well, I'd probably say I'm very proud of my family.
Right.
Just because they're, all of them, wife and everybody, they've kind of knew what they wanted and figured out how to get to where I want to be and taking all those steps to do it.
They probably have that kind of personality. You have kids, right?
Yes.
Then in their 20s.
Yes.
You probably have that kind of personality because there's something about genetics, but you probably put them in environments where they could find like-minded people.
Yeah, we certainly did. Yeah, I mean, was really the goal. I see, even back when I was teaching school, but I see a lot of parents of young kids that we know that, they try to manipulate every situation their kids in. They try to not only put them on a path, they try to clear the path, they try doing this. And to me, that's a little bit of a scary slope that, people have to learn to fail. And you have to learn what you do after you fail, because you're not always going to succeed. And how you're going to react to that. And do you have the stick-to-itiveness and the withiness to kind of figure the path out? And everybody's going to go left and go right a little bit. I think job of a parent is, okay, this is the path you want to be on. Let's figure out how do you get through that path, and let's figure out how do you stay on that path. And when you're getting off it, I'm going to be here to tell you that was probably a mistake, right? So maybe let's try more of this and less of that type of thing. But not to do it for them.
How much did being a teacher prepare you in some regards to be a parent?
So I think a lot. I thought I was a good teacher right when I started. Turns out I was terrible. Because, you think you know everything. Come to college or trained to do all this stuff.
Yeah.
They're not really trained to do anything but survive, okay? And then you're not very empathetic to excuses that parents have for their kids.
How long were you a teacher before you became a parent?
So let me see. I started teaching in 93.
Because I noticed a
97.
huge difference in all of my children's teachers when they didn't have children.
Mm-hmm.
Like, let's say my son had a teacher in second grade, and by the time my daughter came, she had the same teacher, but in the interim, she had a child.
Mm-hmm.
And
you noticed what?
Well, number one, she thought she was being a good teacher because she thought she was being a whorehouse. Mm-hmm. And she had no idea, like you said, no empathy, mm-hmm. no understanding how to, the gentle correct.
Yep.
Or what things needed a hard correct and what things didn't.
Yep.
I guess that's the best way.
So having your own kid gives you experience. But like you're talking about the business stuff, the older they get, more experiences we have in life kind of teaches us that maybe our way is not always the right way. There's other
Amen.
ways to do things, right? So I think that's where it comes down, right? That you have had the experience, you realize, oh, I can see that, and it's not okay, but I understand why it happened, and let's see how we can get better, right? That sort of thing. So for sure.
Challenges. What do you think was the toughest challenge? Because, you know, coming from one career like that, and I will say, like, my sister's a teacher, and she told me, people will say to me, oh, it was the children that, you know, she said, I enjoyed the children. She said, low pay and administration in general, you know, whatever bureaucracy there is, that did not really value, didn't really value the teachers, and had people who did not know how to teach evaluating them. Who wants somebody who doesn't know what they're doing to evaluate your performance?
Right.
You know?
Yeah.
And I guess the other thing she said, you know, sometimes a child's development, you might be a great teacher, but they don't have the wherewithal and it clicks in the next year or whatever, but they're judging you, like, to make you accountable.
Right. So, you know, and school systems have gone through different ways to try to fix these problems, as in giving merit raises for the better a class does.
Right.
But then you factor in this teacher could be doing everything they should be doing, but they just got a tough situation of a classroom, right? But it is disheartening in teacher that feel like they're doing everything they can. They're putting in all this extra time, spending a lot of time extra with the kids or on the phone with the parents doing things. And somebody who's been doing it for way longer, who's kind of mailing it in, is making even more money.
Right.
Like, I'm just a big believer in, you know, the people that are working the hardest and having the greatest results should probably be remunerated the best, right?
So there's probably a better way to evaluate their performance.
Probably.
And there's probably people who should be studying that, because these are, you know, the future. But it doesn't look like it's happening.
No, I think there are people. I think it's just not a very easy solution. Like, I'm someone, I try to live my life where I don't just point out problems. I'd rather say this looks like a problem and let me see if I can be part of the solution.
Absolutely.
So I'm pointing out a problem, but I don't have a solution. So
Right.
it's probably not even for me to talk about, you know, in that sense.
You know, I just wish that they would study the problem, because it seems like people are leaving, you know, in college. My son worked at a charter school, and they were desperate for him to substitute, take a quick test, and come in and teach. Now, having children teaches you about children, but, you know, understanding the psychology of a child, and when they can understand things, and just because you know chemistry doesn't mean you can teach it.
Correct.
And they're just sliding people in left and right because they're desperate. But, well, I don't know. Would your greatest challenges have been during that time or afterwards as a business owner?
I think every situation has its own unique set of challenges. I mean, listen, me personally, my biggest challenge when we decided to move here and open this business from Miami, my wife's Cuban and her entire family's there. So getting a Cuban,
out of there?
Yeah, you just asked about a challenge.
I don't know if I would
right.
do. I would. How you mean?
Getting a Cuban to move out of Miami.
Getting her to move away from her family, because who's going to take care of your children when they're sick, and who's going to? Because I'm not having a 16-year-old kid come in and take care of my kid.
Right.
You know,
I never did have a baby.
Oh, hell no, no.
So.
And I'm sure she really wasn't down with them spending the night anywhere either.
Right.
That was not a thing.
Right.
Yeah, my husband's saying, oh, and he, you know, I was like, yeah, we don't spend the night. That means none of these kids are spending it anywhere. They can have 18 people at my house.
Right. Yeah.
I had 18 places for people to lay, have a pillow, be comfortable. And, you know, after that, I had to throw a few of them on the floor. But, you know.
Absolutely.
So that was your greatest challenge.
Right.
We've had charmed lives.
Exactly.
Right? So you married smart, and you got her out of Miami.
Right.
You guys got to make some frequent trips down there, though, right?
For a long time, we did a lot.
For a long time.
I mean, doctor's appointments, dentist appointments. You didn't go to people you didn't know for your whole life, you know? Yeah.
Well, it all worked out because the kids are on the way, and they're on a great path.
Yep.
And that's the biggest achievement that's the crowning achievement of everything, isn't it? So we do everything else we do.
The goal is to make them better than you are, quite frankly, you know, help them be better. So.
Amen.
Yep. Yes.
So.
Absolutely.
Well, thank you for coming over.
Absolutely.
I appreciate all the education. I hope people who have had some sort of an injury or some sort of a problem that they're undergoing that don't understand anything about testing are a little bit more clear about the fact that if they have anything other than a bone problem, that they need an MRI.
Yep.
And are proactive about their health.
Yep.
So
Well, Tampa Bay Imaging, we're there and ready to help anytime we can. So
I love it. So
But I
thank you
appreciate
so
talking.
much.
My pleasure.